Hi, everyone. This is Dr. Cleopatra. I'm here with Dr. Roseann, and you can see both of us as well as our special guest on Facebook on Dr. Cleopatra and also on Dr. Roseann and Associates. Hi, Dr. Roseann.
Hello, Dr. Cleopatra. Hello, everybody who's here to join us.
Hi, everyone.
So
Great to have you.
great to have you. We're here for the parent talk, and the parent coffee talk. It's something that Cleopatra and I, have wanted to do, and we thought this was a great time because everyone is really struggling, and we're here to support, the health and well-being and the mental health of children and families and moms and anybody who needs it. So thank you for joining us on our inaugural Facebook Live, which is actually going to be a podcast from now on.
Yes, so
Yay!
exciting.
So
Yes.
excited. What we wanted to do is, like I said, to support you. And every day we are going to bring on an amazing expert. And today we have Dr. Elisa Song, who's going to be joining us shortly. We're out of our minds with excitement.
We're so excited to have Dr. Elisa Song. She is a leading holistic pediatrician. She has written an incredible and thorough article on the coronavirus, the novel coronavirus that we're seeing currently, that has been downloaded hundreds of thousands of times, if I remember that correctly. And she was also featured in National Geographic about whether families should cancel their spring break travel due to the coronavirus. So she is an incredible expert who has a lot to say, and a lot to say in particular to help all of us separate fact from fiction when it comes to the coronavirus.
And yeah, she really has brought some great information to the table for parents to help make decisions going forward. And, so we're all feeling very stressed. And that's really what Dr. Cleopatra and I, this was born out of trying to support so many people who were trying to reach out to us. So we thought, you know what, let's make our community, let's help people every day at 3:30 Eastern and 12:30 Pacific to help you along in this journey that we really have never been through before. This is only the fourth time that we've had a pandemic, and we really wanted to make sure that we brought you the right information. And that's what Dr. Elisa is going to do today. And certainly, if anybody has any questions, please let us know.
We'll be watching the chat. Yes.
Yeah. And if there's anything that's going on that you feel like in your world that we could help you with, that's what this is about. We're going to we're planning, but we're also going to organically really try to support you. Right, Cleopatra?
Absolutely, 100%. So our goal with these parent coffee talks is to serve our community and answer the questions that are coming up that people feel like they need answered quickly so that they can take immediate and intelligent action. And what we really want to focus on with these coffee talks is what are the things that are within our control. So having accurate information, having the highest quality information, having information that isn't sensational in any way, that is grounded in being realistic, but also in what's possible for us and our families going forward based on fact and scientific probability. And then once we know that information, what are the things that are within our power to control? And that's what we want to bring to you as our focus for these parents coffee talks, because I know there are a lot of places you can go to read about things, and a lot of times you get information and then the question is, what do I do with this information? And maybe it's also, oh my gosh, I have this information and I feel even more scared than I did before. Or is this information suggesting that I shouldn't be concerned and that I don't really need to take action? So this is the place where you can get the right balance. of accurate information, and I believe setting the right tone for that information, and then really focusing above and beyond that on what are the things that are within our power to control going forward for ourselves and for our families. So today, the topic that we are focused on is how to manage our own anxiety in a very anxious time and in a very anxious world. And so Dr. Elisa Song is coming to help us separate fact from fiction so we can keep everything in perspective. And then after that, we'll talk about what are the things, given the facts, that we can do to manage our own anxiety when the world around us feels really anxious and we're being bombarded with that anxiety and that energy around us. And then tomorrow, we're talking about a really important topic, which is how to help our children manage their anxiety in this anxious time and in an anxious world. And we all know that helping our children starts with looking inward and taking care of ourselves. And so that's why we're starting with helping the grown-ups, helping ourselves first. Hi, Dr. Elisa Song. We're so excited to have you here.
Hey! Oh,
Can
good.
you hear me?
We
Yeah,
hear
we-
you,
okay,
and
good.
you sound and look beautiful. So
Okay.
Yes,
we,
awesome.
we just started the dialogue, Elisa. We're just talking about, you know, moms and what we can control,
Mhm.
and that's our own level of worry and stress, and how important it is for us to feel calm, the best that we can in this hard situation. But I think one of the things that is causing a lot of distress for families is inaccurate information, and we're so grateful to have you here as such an
Yes.
expert on the accurate information. So thank you.
Oh, yeah, you're welcome.
Yeah. So, you know, let's dive in, and please, if anybody has questions, put it in the chat so that Dr. Cleopatra can ask the questions. But, you know, let's start with the basics, Elisa.
Yep.
And for people, you know, what do people need to know about the coronavirus, and what are symptoms? What should they do? And we'll, you know, let you lead.
Thank you for being here, Dr. Elisa Song, and for sharing the extensive research and information gathering that you have been doing with our community.
Oh, yeah.
Yeah.
Yeah. Of course. You know, I mean, and I tell people really, I mean, I'm not an immunologist. I'm not an infectious disease doctor, but I am a pediatrician and a mom. And, you know, I did all this research because of all of I just wasn't sure, right? I wasn't sure what to believe, what not to believe, what was true, how afraid we should be, how calm we should be. You know, it runs the gamut, right? From people who are on the one end, I'm not worried about it. I'm going to go out, you know, like usual. I'm not going to let life stop, you know, for me. And on the other hand, you know, from complete panic and fear. And so I did all the research I could, because I needed to know what I should tell my patients, and
Yes.
also how I could keep my kids and my family safe,
Yes.
right? Because in the beginning, we didn't know really, well, we knew the devastating impact in China, but we weren't quite sure what that meant for our families. If you're a mom, you know, what does that mean for your kids? Because our directive as moms is to keep our kids
Yes.
healthy and safe, right? And so, you know, what is coronavirus? Well, coronavirus, or I should say, what is the current circulating coronavirus that has everyone freaked out, right?
Yes.
Because we know that there are many, many different coronaviruses out there. Many of them cause either no known symptoms or symptoms that are really just the mild common cold. What we are concerned about now, though, with the circulating coronavirus, is that this is what's called the novel 2019 coronavirus. You're also going to see terminology. It will be called 2019 nCoV, is the other name for the virus, or you'll also see it as SARS-CoV-2, which is really confusing because, you know, many of us remember the Sars epidemic that was such, you know, way back when. Well, the reason that is because SARS and MERS are and were caused by human coronaviruses, and this circulating novel coronavirus that we're learning more and more about, it was just announced in Wuhan, China, the first cases on December 31 of 2019. So we have to remember, we only have 2.5, actually 3.5 months of data on
Yes,
this new coronavirus. Right?
exactly.
But
Yes.
what we do know is
Mhm.
that it's very similar to the coronavirus that caused SARS. And
Mhm.
so that's why it's called SARS-CoV-2.
Mhm.
Now, people will also see the term COVID-19. So COVID-19 is not the virus. COVID-19 is the respiratory infection that the new coronavirus is causing. So what are the symptoms? And this is where it gets really confusing because we are also still in North America and in many parts of the world in the middle of influenza season.
Mhm.
Last Friday, I just saw a family of 4. All 4 of them tested positive for influenza A.
Yes.
Just the week before, I saw 2 cases of influenza B. So we are still seeing a lot of influenza. We're seeing a lot of colds.
Yes.
And then to top it off, it's March right now. I'm looking outside, the cherry blossoms are in full bloom.
Environmental
Yes.
allergies.
It's
Yes.
allergy season. And I
Yes.
know if my voice sounds a little froggy right now, I've been congested and sneezing.
Mhm.
And with allergies, my eyes are itchy. But of course, the fear grips you and you're like, oh my gosh, is
Yes.
this coronavirus or
Is
not?
it it?
Right?
Yes.
So what are the symptoms of coronavirus? They're
Yes.
similar to the flu,
Mhm.
where almost always there will be a fever and a
Mhm.
cough.
Mhm.
Okay, that is key.
Do we know what the timeline looks like? Are people typically getting a fever first and then a cough? Like, how is that? What does it look like for people?
Yeah. So typically, again, the incubation period we know is on average, it's about 2 to 14 days.
Mhm.
Okay.
Most people are getting symptoms within 4 days of getting exposed.
Mhm.
It typically starts with a fever
Mhm.
and maybe some body aches, right?
Mhm.
So fever first, and then the cough develops. Now,
And does the fever have to be a high fever? Now, again, I'm trying to get out
Yes,
the misinformation that we're hearing.
Yeah.
So fever is typically high,
Okay.
Mhm.
right?
So a 102 or above.
Yep.
Okay.
Now with the caveat that very young kids and adults who are immunocompromised may not show much of a fever. Okay?
Mhm. Mhm.
But with the fever, so typically there's a fever and there's cough and maybe some shortness of breath, right? That feeling that you can't catch your
Yeah.
breath. But
And is
cough,
it true that the cough is dry and not wet, not phlegmy?
yes, usually.
Okay.
Right. And I wish I could say for sure this is absolutely
Right.
always, but the most common presentation is fever and a dry cough.
Okay.
Now, there have been case reports of maybe some kids presenting with diarrhea. That's not common.
Mhm.
What are more commonly also associated are going to be some body aches, fatigue, right? You want to be a couch potato, and maybe a little sore throat.
Sore throat.
Mhm.
Right.
Maybe a headache, right?
Mhm.
What's really interesting to note is that runny, stuffy nose is not that common,
Right.
Mhm.
right? So that makes me feel much better, when I see a patient coming in with a runny, stuffy nose. Sneezing is
Mhm.
not a common feature,
Mhm.
much more likely to have a common cold or allergies,
Mhm.
right?
Yeah.
So now what we worry about are that, of course, what's in the media every day, and we can talk about, why it's so important to limit your media exposure, especially now,
Yes.
right? Because you cannot pick up the paper if you still read the paper, right? Or more likely you're going to be on your news feed, right?
Mhm.
And just see another report of, how many more deaths there have been across the country. And we need to take that into context. The deaths are devastating.
Mhm.
We cannot take those lightly.
Mhm.
But the vast, vast majority, over 80% of people are reported to have mild symptoms
Mhm.
and not go on to need hospitalizations or intubations, ICU care, and not go on to have sepsis and death. So that's really important to remember. And especially as parents, it's really important to remember that children seem
Mhm.
to be relatively spared. So it's not that
Often. It's
children
so
can't
often.
get
Yeah.
COVID-19. It's just that kids, when they get COVID-19, they appear to present with very mild symptoms and maybe even zero symptoms, be completely asymptomatic. Now, for me, that is a particular concern in a way, right? I'm glad,
Yes.
right? I can breathe a
Yeah.
little easier that Kenzie and
Yeah.
Modi are relatively protected. On the other hand, what I worry about then is whether or not our children are really the most common vectors for
Yes,
transmitting the
exactly.
disease to
Mhm.
vulnerable populations, right? Like grandparents.
Yes.
My sister was supposed to fly to Florida to see my mother and my stepfather, who are in their 70s,
Mhm.
this week for their spring break.
Mhm.
And she was on the fence until very last minute and finally decided not to go.
Yeah.
And I'm going to have to recommend that children really, for this time, while we are practicing social distancing,
Mhm.
really minimize your contact and all unnecessary contact with those we know are vulnerable.
Yes.
So who are
Absolutely.
those who are vulnerable?
Mhm.
Vulnerable, age seems to be the number one factor.
Yes.
Over 70, for sure, over 80.
Mhm.
Much more at risk for serious complications and death.
Mhm.
And then we also have people with chronic illnesses or chronic health concerns,
Mhm.
autoimmune illnesses,
Mhm.
diabetes, high blood pressure. So if you have a family member who has a chronic health concern, especially one that's not in good control, because I
Mhm.
do get this question: well, my child has asthma. Does that mean he's more at risk? What about Hashimoto's? What about
Mhm.
any other concerns? And
Mhm.
if you can be well and thriving with your chronic illness, or you can be sick with your chronic illness. So if you are doing all the right things to be as healthy as possible, even if you have a chronic health concern, that minimizes your risk. So really, this is the time to step it up and take care of yourself and teach your children lifelong healthy habits for good prevention,
Absolutely.
Mhm.
right? This is really, we want to look at some of the unanticipated opportunities here for our kids, for our
Exactly.
families.
You hear people talking about, well, it's this crazy stressful time and the kids are at home anyway. And so we're just lounging around watching TV and eating junk food.
Oh,
And it's actually the perfect opportunity to teach the opposite of that, right? Like
yes,
how do we be resourceful in this moment and still get to move our bodies even when we have limited physical space?
that's
How
right.
can we focus on eating the foods that nourish our minds and our bodies and boost our immune function? How can we focus on getting the benefit of social relationships, which actually protect our immunity
That's right.
even when we're
That's
in
right.
this moment of social distancing? So I wonder if you have any thoughts on that.
Yeah. Well, I want to remind people that in this day and age of technology and things like this, where we can
Uh-huh.
FaceTime,
Yeah.
our family members and
Yes.
friends,
Yeah.
as much as I try to limit technology, this is the time where we
Use
really
it.
want to remember that we
Yeah.
are fortunate to be in this position where social distancing does not have to mean social isolation. Because
Exactly.
we know that
Mhm.
isolation is a risk factor for poor health outcomes,
Mhm.
right?
It
So
is.
staying connected, FaceTime the grandparents, set up virtual play dates.
Mhm.
It also doesn't mean social distancing doesn't mean that we have to stay indoors all the time.
Yes.
And
Right.
not all of us, especially here in the Bay Area in California, we don't have big yards. It's not like we
Yeah.
can go out and like kick a
Yes.
ball, right?
Yeah.
But yesterday it was raining, but when there was a little lull, I took the kids out. We went up to the park. We did not meet a group of 20 kids at the park. It was just my kids and me.
Mhm.
And there were other families who were playing in family units, right?
Mhm.
Kicking the ball back and forth. And, we just went around the track and, kind of explored some of our trails. But we did that as a unit so that we still can maintain that 6-foot bubble,
Yeah.
right?
Yes.
The fresh air is really important. And in terms of the factors for when we are social distancing, when we are staying at home and trying to protect our communities and slow down the spread, this is also the time to talk about to our kids, what can we do to keep our bodies healthy, our brains healthy, our immune systems healthy? What can we do so that our body is as strong as possible,
Mhm.
for if and when we get coronavirus?
Mhm.
Yeah.
What can we do to keep our communities healthy and safe?
So
Mhm.
this is a great time, Elisa, to ask the question. So if a parent thinks their child has a coronavirus, so we talked about some of the symptoms. We talked about there being a crossover, particularly with the flu, but also in that if you think they have allergies or a cold because they have a runny nose,
Mhm.
then they probably don't. But if they think they do have coronavirus, what's your best tips? How should they handle this?
Okay, so given that most coronavirus infections are going to be mild, right? Even
Mhm.
for
Yep.
us as adults, right?
Mhm.
One of my first suggestions is to um, really do what you would normally do if it were a cold or a flu-like illness. And the vast majority of us are not running to the doctor's office and
Right.
not running to the ER
Mhm.
immediately.
Mhm.
So only consider going to the doctor or going to the ER if you would have otherwise. Now, if your child is having trouble breathing, then absolutely go,
Of course.
right?
Mhm. Mhm.
If they're dehydrated, haven't had any urination,
Mhm.
in over 8 hours, call your doctor. My first step would be, if you're concerned, call your doctor, right? And
That's
talk
right.
about, is it time to get tested? Now, testing is a whole other problem because yes, LabCorp and Quest have rolled out testing. Many hospitals have, but we are still very, very limited in our resources. And we are still triaging who should get tested.
Mhm.
So we're still limiting at Stanford right now. Currently, they are still only testing those with fever and respiratory distress, right? Trouble
Mhm.
breathing
Mhm.
and severe cough. They're not testing everyone who comes through the door. And I would urge parents to really remember or know, if they didn't know, that many, many cases in China were really because of people who were waiting in lines and crowded in these
Yes.
small waiting rooms in the ER to get tested, whereas if they didn't have coronavirus in the first place, they caught it there or transmitted it to other healthy people if they did have it. So
Mhm.
again, the social distancing, very important. Now, as an integrative pediatrician, there are a lot of things that I use that I have in my toolkit that I teach families because,
Mhm.
as we know, for coronavirus, there is zero known cure or treatment.
Exactly.
We
Mhm.
have nothing that we can
Mhm.
do from a
Mhm.
conventional medicine standpoint
Mhm.
except watch and wait,
Mhm.
maybe give some symptomatic relief. And now
Mhm.
there's some possible evidence that ibuprofen may not be beneficial. Although I have a blog post that I'm writing, and literally it's been on my mind because I need to really tell parents what we should know about ibuprofen and reducing fevers. But I do use a lot of natural medicines, homeopathy, herbs, essential oils, acupressure points. And this is not to say that this will cure or treat your child with coronavirus. However, knowing that many of the symptoms are very similar to upper respiratory infections, cold, and to
Mhm.
flu-like infections, we
Mhm.
can do a lot of the same things.
Mhm.
So I will use as my first line oscillococcinum, which is a
Mhm.
homeopathic flu
Mhm.
remedy.
Mhm.
Um, the typical dose is 1 vial. You just take the whole vial, suck on it, 3 times over a 24-hour period.
My kids
Um,
love it. They always want
oh,
more.
absolutely, absolutely.
No kids get
Homeopathy is
enough.
not hard to sell for
Mhm.
kids,
Yeah.
No, it's
to
not.
kids. Vitamin D, and some
Mhm.
of these things, hopefully your kids will already be on, and we can talk
Mhm.
about what preventive things to do
Mhm.
also. But vitamin D, vitamin C, increasing that when you're sick. What we want to know is when we're sick with an infection, whatever it is, the infection creates inflammation, right?
Mhm.
Creates free radicals in our
Mhm.
body. And
Mhm.
it's actually not the infection that makes us feel sick, right? Because
That's right.
in this family of
Mhm.
4, this is a perfect example, who had influenza A, the dad and the oldest boy, they were on the couch. I mean, bleary-eyed, looked miserable, could
Uh-huh.
barely move. I mean, they just looked like a train hit them.
Mhm.
The mom looked okay. She was actually, doing pretty well, but she just had a headache and a stuffy nose. The baby, 18-month-old, running around, little snotty nose, but playing with the toys, acting like nothing was going on, right? They all had influenza A. So clearly, it's not just the infection that makes you sick, it's our body's response to the infection.
Yes.
So we create free radicals, and we need antioxidants, right?
Yes.
Free radicals is another term for oxidative stress.
Yes.
So we need antioxidants to mop up those free radicals to help us feel better,
Mhm.
right? So it's
Mhm.
our body's inflammatory response. So when we have enough antioxidants on board, right, when we're sick, or we can throw them on, after we get infected, we can get better so much faster. We also
Mhm.
feel less sick. So
Mhm.
what are those antioxidants? Vitamin C is a major antioxidant, which is why I
Yes.
supplement when we're sick. But at baseline, we want to get all those antioxidants from colorful fruits and
Mhm.
vegetables. So
Yeah.
think color, because that really is where you're going to get all of your antioxidants. And that really goes such a long way. And first of all, reducing the likelihood that you'll get coronavirus in the first place, maybe, but also significantly reducing the likelihood that you'll feel really sick and have major complications from coronavirus. So
And the good news is at the grocery store, there seems to be a lot of vegetables currently available.
That is exactly right.
Like all the junk food is gone. So like I know
that is so funny. Yeah.
Food, but you need thinking to comfort food being actually healthy food, right?
Yes. Now
So,
let's talk about, let's talk about that junk food, right?
Yeah.
Because that's really important for moms to understand. When we're, when life is topsy-turvy and we're stressed out, many of us, not just kids, but adults too, will reach for the ice cream carton, right? Or we'll reach for the chocolate. And especially now, that is really one of the worst ideas that you can have, because one of the first things that I'm recommending to families is just cutting out the sugar, right? That refined sugar in their household. We know that sugar, so refined sugar, within about 2 hours of ingesting and lasting up to about 5 hours, significantly reduces your white blood cells' ability to eat up those viral or bacterial particles that you've been exposed to, which is exactly why, when your kids go to a birthday party and there's Skittles and there's cupcakes and there's ice cream, right? All that junk food. No wonder that they come home and the next day you're like, oh yeah, they have a fever now.
Yes.
Right?
Yeah. Like invariably. Yes.
Yes. So I've already had that conversation many times over with Kenzie and Bodhi, and they know for this time, the next 2 weeks, 4 weeks, 8 weeks, however long it takes, sugar is not going to be a part of our diet. Now, am I going to give them occasionally a little bit? Yeah, a little bit, right? But it's not a free-for-all, right? Just because we're home and schedules are different does not mean that our schedule should be significantly different at home. We still want to maintain, as much of a normal schedule within this different structure of life that we have as possible. But sugar, number one, get out the sugar, swap it out for fruits and vegetables. Really that could be one of the most important swaps that you make for your family.
And it's such a good point because people don't understand when we say no sugar, it's really about what it does to the immune system. So thank you for bringing that up because, that is something moms and dads can control right now. And that's what it's really, really about. So in understanding, and just to recap, like if a parent thinks, this is what I'm hearing every practitioner say, if you think your child has a coronavirus and you're unsure of what to do, call your physician. Don't run to get tested unless you obviously trouble breathing. Let's talk about our immunocompromised kids. And what you would consider immunocompromised is it kids with asthma. You and I both work with kids with PANS and PANDAS, autism. These are kids that tend to struggle more with infection. Can you give any, tips or suggestions or advice for those families? Because I'm getting a lot of questions from those families.
Yes. So for the kids with PANS and PANDAS, and I just spoke with Scott and Ellen Antoine live on that. And so I would say if you have a child with PANS or PANDAS or have a child with autoimmunity or, any immune compromise, we spoke a lot on some of the ways that we might specifically help support our kids during that time.
And they'll be back. They'll be on this.
They'll be coming here as well. Yeah.
But I do have concerns. I see a lot of kids with autoimmune illnesses too, juvenile arthritis, Crohn's disease, ulcerative colitis. Yes, those may confer higher risk for more serious illness. So for those kids especially, I would say it's very, very important to make sure that diet is clean, that you're sleeping enough, right? Getting your fill of sleep, because sleep really is important for the immune system. Getting outside, moving your body a little bit, getting some exercise. And then for all kids, but especially kids who have underlying chronic illnesses, I do recommend supplementing with vitamin D. I do recommend probiotics and fish oils. I would likely throw in some extra glutathione, right? Just to really make sure that your kids' immune systems have the best chances possible, even yours, right? Many adults have, autoimmune disease in adults is rampant. Hashimoto's, right?
And for those people that don't know what glutathione does or is, can you just give a quick description.
So glutathione is our master antioxidant. It's a
Mhm.
compound that is made in our body that we can enhance the production of it either with direct glutathione supplementation or with something called N-acetylcysteine. Or we always want to talk about food as medicine with
Mhm.
all of those yummy cruciferous vegetables,
Mhm.
right?
Mhm.
Kale, cabbage, broccoli, cauliflower,
Mhm.
collard greens, all of those. Did I say cabbage? All those yummy kind of
Yes.
fruity
Yeah,
vegetables,
yeah.
but they're sulfury vegetables, but they really help. Epsom salt baths will enhance glutathione. Now,
Mhm.
why is glutathione important? Glutathione is, again, our master antioxidant. So remember, I
Mhm.
mentioned those free radicals. Glutathione will immediately kind of mop up all those free radicals and help us feel so much better when we're sick.
Mhm.
Glutathione also helps us detoxify whatever else is going on, really important for the liver.
Mhm.
And so, unfortunately, especially here in Silicon Valley, we're not seeing that many cars out right now because everyone's at home. But,
Yeah,
um,
really.
Yes.
but we have a lot of other um, toxins that are stressing out our immune system.
Yes.
Um, we know that depletion of glutathione, so what's really fascinating is Tylenol, acetaminophen. We
Mhm.
know that Tylenol depletes glutathione levels and can
Mhm.
impact the liver.
Mhm.
Now, there is evidence that taking Tylenol during viral infections, this was looking at varicella, chickenpox, but taking Tylenol during that time can actually prolong the duration of your illness and
Mhm.
the severity of your illness. These are
Mhm.
viral illnesses. So this is where I talk to parents a lot about not having fever phobia,
Mhm.
right? Fever is our body's natural
Yes.
response to killing or fighting infections, doing its job. Reducing fever artificially can can hinder that process, make it a little
Yes.
harder for our immune system to do what it's trying
Mhm.
to do.
Mhm.
So, not that I never treat fever, but when do I really consider giving a fever reducer? It's not the number, it's looking at your child. Okay,
Yes.
because some kids at 100, my daughter, she was 105.5 when she had influenza B while we were in Hawaii, right? This is a
Oh,
max
wow. Oh,
the
wow.
influenza B, right?
Oh, great.
We were all together in January. And
Yes.
so, but yes, she was laying on the couch, cheeks were bright red. She was kind of, glassy, tired, but she was talking to me. She was drinking. She was, acting okay. I was
Mhm.
shocked when she was 105, right? But did
Mhm.
I give her a fever reducer? No. I just let her sit there. I gave her some homeopathy. I gave her some herbs. By the next day, she actually was remarkably better, right?
Mhm.
But so that's her. And some kids run hot. Other kids, when they're 100.5, they're miserable on the couch, crying. They can't move. They don't want to drink. So look at your child, please, not the number. And
Mhm.
then, consider a fever reducer if they are so uncomfortable that they can't drink and stay hydrated, because that's super important.
Mhm.
Or if they can't get comfortable enough to fall asleep and have a good night's sleep, because
Mhm.
sleep really trumps everything when you're sick. Uh,
Mhm.
so again, really we want to just make sure that we're doing things judiciously, really thinking about what we can do to help our kids. And of course, we don't like to see our kids suffering and uncomfortable, but that's where using the homeopathy. There are homeopathic medicines, essential oils. Lavender has been shown to help reduce fevers and reduce inflammation. Some acupressure points. There's an acupressure point right here on the
Mhm.
back of your thumb, in the
Yeah.
web space between your thumb and your
Mhm.
index finger. It's
Mhm.
called large intestine 4.
Mhm.
This spot has actually been shown in research to reduce pain,
Mhm.
relieve headaches, and reduce fever. So
Mhm.
why not put that lavender essential oil right here and massage it in?
Mhm.
Right. So we have some tips and tricks up our sleeves, and I can give you some resources too, to share.
That'd
But
be great. We would love
yeah,
that. Mhm.
but we do have a lot of things that we can do, especially knowing that with coronavirus right now, there's not a lot we can do conventionally.
Mhm.
So again, I don't even remember how we started talking about fever, but I think we were talking about sugar and diet and lifestyle, and that got me on glutathione. So
Mhm.
other
Yeah.
stuff I know. Our kids with
Yes.
special needs. Our
Yes.
kids with special needs. So vitamin C, vitamin D, fish oil probiotics, glutathione. Those are kind of the foundation.
Mhm.
Zinc also can help support the immune system.
Very helpful.
Mhm.
And if you are a child, a patient, a mom or dad, a caregiver of a child with a chronic health concern, then definitely don't hesitate to call your doctor if your child is showing signs of illness,
Mhm.
because that is something that we want to monitor and follow closely. right from the beginning.
Yeah.
Absolutely.
And Dr. Elisa, I know you have this awesome course that is what to do when you have the flu, right? And
Yep.
you have it's a lot of things there that also apply to the coronavirus. And at the end we'll talk about how people can access you, because it's a great course.
Yeah. So I'll give
you.
you the link there. I've been trying to think about how to really help serve families who really need this help. And so, Peter and I are trying to think about how to make that as accessible as possible to people. But it's called Everyday Holistic Pediatrics, because again, with coronavirus, the symptoms are very similar to a flu-like illness. And so just because we don't have any treatment options in our conventional, medicines pharmaceutical toolkit, we do know that there are many natural medicines that can help symptomatically, right? And help compress viral illnesses and help you get better faster. And so in that course, I teach families exactly what we're talking about, how to use homeopathy, herbs, supplements, essential oils, and acupressure points for not just flu, but for fever, colds, and coughs, right? Because we need a lot of cough support. Vomiting and diarrhea, sore throats, pink eye. But we want to have all, as a mom, right? I know for me and for you guys, you want to have all the tools you can, in your toolkit, because kids usually get sick in the middle of the night when we don't want to go to the ER, but we also want to have things that we can do at home. And feel empowered that we can help our kids.
If there's anything to gain out of this, it's that there is a learning that can occur here, and that the three of us moms always use homeopathy.
Absolutely.
I always use homeopathy right from the get-go, and have been using my entire life these type of things. And so this is a gift for parents who realize, if my kid has a tummy ache, it's coronavirus, there's something you can do with it. And so it's a wonderful resource, Elisa, for parents.
The other thing I want to tell families is there are, and I know, Roseann, that we'll be talking about this too, but and you've talked about it a ton, but the fear that we feel as parents is definitely something that our kids will feel, especially from their mamas, right? Papas are amazing, but there is a bond between mamas and their kids that is really just unlike any other bond. And they will, even if you are trying to hide your fear and anxieties, they will sense that. And it's really important that a couple of things, when we sense that our kids are anxious, even if they're maybe too young to verbalize it or express it in a way that we understand, what exactly they're thinking, or maybe they're teens and they are really afraid they're going to die, right? That we need to be able to have that conversation with them. But first, we want to make sure that we are caring for ourselves and being able to be in a place where we can approach this with more preparation and calm. And I'm not going to say that I don't get nervous and afraid sometimes, right?
Yes.
I would be lying if I said I'm so calm and mellow throughout this whole thing.
That's exactly right.
That's why I do all the research. And for me, my coping mechanism is to do the research. Right?
Yeah.
But we all have to figure out our coping mechanisms. And then with our children, depending on what age and developmental stage they're at, we want to answer their questions, but really answer the questions they're asking. Most kids have very concrete questions, and they're not, and they don't want long-winded answers. Bodhi the other day, he asked me, just out of the blue, we were actually just hanging out, kind of having fun, and just out of the blue, he asked, Mama, is it true that all grandparents are going to die from coronavirus? And I stopped for a moment. I'm thinking, oh my gosh, okay, what do I say? And I said, no, that's not true. Actually, most are going to do just fine. And he said, okay. And he was fine with it. He didn't want or need a long conversation. But if we can frame this as, because there are a lot of no's and don'ts in this, right? There's a lot of don't touch your face. No, you can't have a play date, right? No, we're not having sugar, right? And so we really want to focus on helping our kids and our teenagers understand what they can do to help themselves, keep their bodies strong, their brains strong, and also help our communities. The more they feel, the more we feel that we can be proactive, which is why I'm so glad you're doing this series, the more that we can be proactive and our kids can feel like, yes, I can do something. In this time of helplessness, I have the power to do something that's going to help me and my friends and my family and my community. That will help relieve the stress that actually can be more inflammatory than anything else that's going on.
That's absolutely right. Such a good point, Elisa. Thank you for that. I do have a question about glutathione. Glutathione, when supplemented, is not easily used by the body. And so a lot of people say that glutathione supplements are just very expensive urine. So I'm curious about what you recommend in terms of glutathione supplementation.
It is true that
Mhm,
historically glutathione has not been easily absorbed and
mhm,
utilized by the body, which is why
mhm,
many people use N-acetylcysteine or NAC, which
mhm,
is the precursor to glutathione, which
mhm,
can be more easily absorbed. So you can certainly use N-acetylcysteine.
mhm.
That being said, there are more and more liposomal
Yes.
glutathione products on the
Yeah.
market that are more easily absorbed and used by the body. Um, and so I do use a variety of liposomal glutathione.
Mhm.
The trick with glutathione, and for me as a pediatrician, I'm always on the lookout for supplements that will be relatively easy for kids to take,
Yes.
that aren't sugar-filled gummies, right?
Mhm.
And
Yeah.
that provide therapeutic value.
Mhm.
Now, the problem with glutathione is that, I mean, just to be straight up, there's just
Yeah.
no way to make glutathione taste
It
great.
tastes bad. It's
Right?
true.
It's sulfury. I mean,
Yeah.
it's like
Yeah.
rotten eggs. It kind of
Yeah.
tastes a little like rotten eggs.
Yeah.
But that being said, there are some that are definitely better, right? You know, Research Nutritionals has a um, pretty good tasting one. Quicksilver Scientific,
Quicksilver. Yeah.
yep, Designs for Health. I mean, they're fine, right?
Mhm.
My kids' taste buds aren't the best measure because I've been giving them a Chinese herbal formula called Windbreaker since they were babies, and so they'll take
They
anything
don't
I give
know.
them.
Same with mine. They taste
Same.
all the
Same.
same.
Um,
They
Yeah.
don't have any
yeah,
idea. Yeah.
but they will take the Quicksilver and the Designs for Health glutathione with like very minimal fuss. And you know what? It's sometimes we just have to say you got to do it, right? This is
Yeah.
just what your body needs right now.
Yes, exactly. Awesome. Thank you so
So,
much for that. I really appreciate it.
yeah. Elisa, as we kind of wrap up with you, and we're going to continue for a few minutes after, what's the best way for everybody to get a
Yes.
hold of
Yes.
Yeah, so a couple of different ways. So my blog site is www.healthykidshappykids.com, and that's where I have a bunch of different not just coronavirus articles, but tons of other articles and resources for parents. But of most interest right now, I have several coronavirus articles, and I'm
Great
writing,
articles.
as I
Yeah.
mentioned today. I'm just putting the finishing touches on the ibuprofen concern with coronavirus because my goal is to bring as much evidence to the table
Mhm.
as possible,
Yes.
but
so
then
important?
make it as practical and actionable for parents as possible.
Yes.
And then I have two other places that are great to follow, especially if you want um, more live and frequent updates on coronavirus and anything else that's going on relevant for kids. So
Mhm.
that's my Instagram page, which is
Mhm.
healthykids_happykids.
Mhm.
And then my Facebook page, which is it's well, just search Healthy Kids, Happy Kids, and you look me up. It's
Yes.
under Dr. Elisa Song, MD.
Yes.
And then finally, I do have a private Facebook group for parents and practitioners who are really invested in living a more holistic, kind of
Awesome.
integrative lifestyle for
Mhm.
their families. And that's a Thriving Child Community Facebook group that anyone's welcome to join. It's private just so that I can ask questions, a few different
Yes.
questions before you join, just so I make sure that we really remain a like-minded community of
Mhm.
families and practitioners all over the world who have that same goal to support one another in a very open, loving way
Mhm.
while exploring integrative, holistic options.
Mhm.
And
Love
you'll
that
share
so
them
much.
with
Thank
us
you.
so that we can share them with the tribe that, our tribes too, because you're such a voice of reason. And I know everything you do is evidence based. And the Cleopatra and I feel the same
Yes.
about wellness. And it's important. And parents need to know there's things that they can do. And, as we move to the topic of, what moms can do. But thank you so much, Dr. Elisa. You are incredible.
Dr. Elisa, thank you for being here and for taking time out of your day to talk with all of us. This has been so valuable, and we'd love any resources that you want to share with our communities.
Oh, absolutely.
Okay.
Thanks for having me. And I'm really, really grateful that you are doing this coffee talk, for parents. It's really important, and then bringing on different experts to talk about all the different facets that we as parents need to really understand. And I will just send you, I guess I'll email you all of the links to everything, and then you can put those up. And looking forward to
Perfect.
Hopefully, if not in person soon, then virtually.
Yes, we were supposed to be together in person, which may get canceled. And we'd love to have you back on to talk about some other topics. So thank you for being here. So wonderful. Always amazing to learn from you. Thank you, Dr. Elisa Song.
All right. Bye, guys.
Thank you. We'll see you soon. Yes. So Dr. Roseann, let's bring, now that Dr. Elisa Song really laid out the facts for us, let's bring the conversation full circle back to what is within our control as moms to manage our anxiety in this very anxious world. And a huge part of that equation is simply knowing what the facts are. And now that we have
a lot of facts.
Exactly. Now that
I love the conversation on the fever. I thought that was incredible because it's great to hear from a pediatrician that it's not the number, it's how uncomfortable your kid is.
Yes.
So validating for parents, and also to know that there's tools. So yeah, absolutely. So, what are people anxious about? We would love to hear from people if you have questions, but it's perfectly okay to be anxious. But as Elisa said, kids are looking for short little answers from you, right?
Yes.
Like Cleopatra, your oldest, what has he said to you? Because he's how old is Apollo now? No, he's not your oldest.
Apollo's actually, today is his second birthday. He's the youngest. Happy birthday, Apollo. So our oldest is 6, almost 7, and really his questions, because we had been talking to them very proactively all along, he didn't have a lot of questions about what's going on. And really now his questions are, when will I go back to school? Is my soccer game going to be canceled? Just very practical things. Our 3 children are not exhibiting any signs of anxiety or discomfort because we have been talking to them all along. So I think that just goes to show being proactive and having the conversations can really go a long way to helping to protect our children from feeling a sense of anxiety about the unknowns and what's going on. And so every day it's just a check-in. Here's what's happening. We're not sure when school is going to start again, but here are things that we're going to do to keep up your normal schedule, etc.
Yeah, and I think we're going to talk a lot more later in the week about setting a routine and what that looks like. But I think it's comforting for ourselves. I think as moms, my kids are at work with me today, and my kids are used to being at work with me, and many of our employees bring their kids to work because I'm the coolest boss ever. So just kidding, but I am. But creating some kind of structure. But I feel like for us moms, most moms are working moms and in America, and so that added stress is going to be hard. Mm-hmm. So find your own routine first. Think about what the kids' school routine is, and that's another way and a tip for parents to be to manage their own stress. I mean, certainly if you have clinical levels of anxiety before, this may or may not be harder for you. It really is unique. Some people have clinical anxiety, man, they've got a toolkit. They've been working with a therapist. They have things that they use, yoga, whatever it is.
Yes.
This is when you pull from your toolkit. Don't wait for it to be freak out level.
Exactly.
Go in there and get your nervous system regulated. You don't have to say anything to your kids. They already know when mom or dad is stressed out.
Is feeling off. They know. Yeah.
They know. So I think what's really important is dialogue with your kids. And you can even say, hey, I feel uncomfortable too. And they're like, oh, okay. I tell the story, I was traveling a lot and I've been on super level antivirals for about 4 weeks. And both Chinese and traditional, a lot of different things. And they worked for me for 25 years that I've been using them. And my little guy a couple of weeks ago said, "Mom, are you worried about the coronavirus?" And I said, hey, Giancarlo, I'm kind of not, because I'm taking these things. I also use Biocidin throat spray, which is absolutely amazing. And I eat really healthy. And he just kind of said, okay, and went off on his own. That was his question. I mean, I am worried. It's serious. But I'm a healthy person. So I'm much less likely to be impacted. I think that if you have health concerns, it's natural to feel worried, but you've got to put your oxygen mask on. So what are things moms can do for themselves? I think is the question, Cleopatra, that we need to wrap up with. What are things that help, right? So
I think that the reality of being in a stressful moment like this or any other stressful moment is that we are living in the most primitive part of our brain, the reptilian brain. We are in stress and emergency mode, fight or flight mode, and every little thing that we can do in the day to bring ourselves out of fight or flight mode and into the parasympathetic nervous system, where we can rest, digest, restore. That's where we're fighting off disease, where our immune system is strong. Anything that we can do moment by moment, hour by hour throughout the day to bring us back to that place of peace and calm and pleasure is going to serve us in helping us to manage our anxiety and set the tone for our children so that we can help them to manage their own anxiety. So the thing about the reptilian brain is that when we're in stress, we're either living in the past or we're living in the future. It's rarely in the present moment. There are some extreme exceptions to that, but for the most part, we are not in the moment. So the things that help us to manage anxiety are the things that ground us where we are, where our feet are planted in the moment. So whether that's, taking a deep breath, doing nostril breathing, which is really beneficial for calming the central nervous system, whether that's shaking to get the stress and trauma out of our bodies, dancing, jumping, rebounding on a trampoline, whatever it is that brings you back into the moment, brings you back into your body and gives your body and your brain a sense of release and relief. Those are the things that we can be turning to moment by moment instead of going through the day holding our breath, holding our shoulders up without even knowing it, and waiting until it is a point of emergency.
Yeah, absolutely. And when we talk about the reptilian brain and when our nervous system gets activated, our frontal lobes actually turn off. So we're not really capable of a whole lot of rational thought, which is why you're either in the past or you're kind of stuck, right? So everyone, there's so many proven ways to help support your nervous system when you're distressed, and to each unique. They've got to be healthy, right? So we don't want you inside eating Twinkies and drinking beer and having 6 glasses of wine. Like, there's all these funny memes out there right now.
Yes.
So, what are things you can do? Journaling, doing breath work, like Dr. Cleopatra said. I love doing a 5-7-8 breath. So, in for 5, hold for 7, exhale for 8.
Oh, good. Yeah.
Meditation, biofeedback, heart math, journaling, prayer. These are things that everybody can do. Yoga, movement, doing some things, and also too, like, we're all going to be cooped up together. We don't know what's going to happen in terms of, are we having a formal quarantine? And I'm guessing that we probably will. So people need to stock up on things they're not thinking about, like healthy food and games.
Right. Exactly.
Yoga mat, whatever it is, maybe you can make a trampoline. Things that can help you relieve stress. If you already see a licensed therapist, pre-arrange to do video sessions with them.
Absolutely.
Don't do therapy. It's important. If that is a source of learning and comfort for you, you need to continue that. If you are that distressed and you don't have a therapist, reach out to somebody in your community. You know, all you have to do is Google. If it's anxiety, you can say anxiety in your town. My town is Ridgefield, Connecticut. You Google it and people will come up. You're going to find a licensed provider. You know, that's really critical. You want to make sure the person is licensed and not go to somebody who's just a coach or anything. These are clinical issues. And so don't be afraid to reach out. And I think that's important. And then, you know, really stay connected. I wonder if the system will be able to hold all the FaceTime.
Yes, we need to stay connected to one another at this time. It's so
we
true.
Do.
Yeah.
We do. And, you know, don't be a news junkie. It's pretty easy. You know obviously we're having experts. We're really trying to open up a dialogue for parents to support their own needs and their children's needs. And I mean, we're just bringing in some of the most amazing experts in wellness in the United States are going to be with us every day.
Let's preview what we have on deck for everybody.
Yeah. So tomorrow we have Dr. Tom Moorcroft, and he's going to be talking about sleep and the importance of sleep. But he's an infectious disease guy and a disease detective, which is pretty cool. Wednesday, we're going to talk about homeschooling and what to do. I'm actually a former homeschooling mom, and there's a right way to do it. And I think some of the biggest stress that I'm feeling from parents is they're completely feeling ill-equipped.
Yes. Unprepared to do homeschool. Yeah.
And guess what? You should be unprepared, but I got some great hacks, and we can get through this together. And then Thursday, Cynthia Thurlow is going to be here. She is a women's health and a nutrition expert.
Amazing. Yeah.
Intermittent fasting TED Talk that over 5 million people. And then on Friday, we have Deborah Wayne, who's an amazing healer. She's going to do some virtual healing for us. And then we have some other people next week. We don't have the times, but go ahead.
Well, we do have a very special guest next week, and that is JJ Virgin. So stay tuned for more details about JJ's visit with us next week. Thank you so much again to Dr. Elisa Song. Dr. Rowe, as always, amazing to be with you, and I can't wait to see you all again tomorrow.
Be well. Stay healthy, everybody.
Yes, absolutely. See you tomorrow at same time.